a decade or more ago, it was decided that the only way to give good TB treatment was to do it by the DOT strategy, or directly observed treatment. It means that someone has to observe the patient receiving this treatment for the full duration of treatment. So today, the DOT strategy is the cornerstone of good TB treatment. Today we have about, let's say about 10 to 15 drugs for the treatment of tuberculosis. And to treat a newly diagnosed patient with TB, we need to treat him for 6 months. And I mentioned how difficult it is to administer this treatment for 6 months. So this need has always been there to shorten this duration to as much as possible. And as I said, with the currently available drugs, it has been found that it is not possible to shorten this duration to 6 months. Added to this are two new threats as far as TB treatment goes. One is the emergence of the HIV epidemic about 20 years ago, 25 years ago. The advent of the HIV epidemic has increased the load of TB in many poor countries. Many countries in Africa which had a bad TB problem, the TB problem became worse when HIV started appearing in a major scale. It is because HIV, as we all know, reduces the immunity of a patient, and therefore you are more prone to get tuberculosis. So this was a major threat as far as TB treatment was concerned. And then we had this emergence of TB, which was resistant to the drugs that we were using to treat this disease. So initially itself, as soon as TB treatment became available, we knew that if you do not treat the patient properly, they will very quickly become resistant to the drugs that are used to treat TB. So initially, when we had only a few drugs, patients developed resistance to isoniazid and to streptomycin. Today, we have a new disease called MDR-TB, or multi-drug resistant tuberculosis, in which the patient is resistant to the two most powerful drugs that are used to treat TB, namely rifampicin and INH. And globally, there is a scare that MDR-TB is increasing. To make it worse, we today have a new disease called XDR-TB, or extensively drug-resistant tuberculosis. XDR-TB is a patient with TB, a patient who already has MDR-TB, but who is also resistant to the drugs which are used to treat MDR-TB. In other words, when we meet the patient with XDR-TB, most of our medicines are not going to be useful. And therefore, today, we are badly in need of new medicines to treat tuberculosis.